Hi, Dr. Gettenberg.
Yes.
Hi,
Hi, Moshe.
extremely informative. Thank you very much for taking my call. I just was wondering, occasionally I have like a feeling like like something coming up, and when it gets triggered by something, I don't know what it gets triggered by. I can have like an hour or so, maybe every 2-3 minutes, and with it comes like extreme burning, like in the middle of the chest, esophagus area. What? Sorry?
How old are you, Moshe?
30.
Uh-huh. Well, have you spoken to your physician about it?
No, because it doesn't happen. Okay, it doesn't happen often. I would say it happens maybe once a month.
Uh-huh. Moshe, does it happen after chillant?
No, not specifically, no.
Well, you know what? Usually I'm sure it has to do something with how you're eating and what you're eating. And remember a very important thing to do when you have issues with digestion and issues with what to eat and what not to eat is to make a list of foods that you're eating and to make a diary, and then to find out, Moshe, when exactly this is happening. Is it happening after something you're eating that you shouldn't be eating? Are you eating too fast? Is your portions too large? These are things that you should bring in to your physician when he analyzes this, and he may try a course of medication or a diet for you. I think you would probably, be treated first with a course of medication or a diet, and I'm sure you'd respond to it. Find a physician with some time who will take you, Moshe, and lead you down the right path. Thank you.
Okay, Dr. Gettenberg?
Yes.
That when I'm, I guess, experiencing like such an attack, is there any benefit in taking something and eating it, or if I could just, hold out until it subsides? Is there any benefit in taking anything at the time?
I'm a big chicken, and I firmly believe in not suffering, and that's why I became a physician, because I think that you shouldn't suffer. So if there's something over the counter that you've taken and you've tried and it works, well, that's good. Take it, and then when you go to your physician, tell him about it, and that may help him a lot. And then again, if you've taken something and it doesn't work, let him know, because then you may need some prescription medication, or you may choose to do some testing.
Thank you so much for the call. Let us now go to Moshe calling from Flatbush. Moshe?
What's going on, Doc?
Hey, Moshe, how are you?
How's everything? I wanted to know, a couple of years, 3 years ago, I was having problems. I was having a lot of stomach aches pretty often. So I wanted to know, so I went to my doctor. He told me, he thinks I'm lactose intolerant. So I got, a lactate pill.
Moshe, am I your doctor?
What?
Was I your doctor?
No.
Okay, good.
No, because, he told me, so I started taking, lactate pills, and, sometimes it worked, and a lot of times it didn't work, and, I took the pills a lot, and nothing was helping. So, but a lot of times it did, with cheese,
Right. You know what? A lot of people think doctors are like Ted Williams. They get a hit every time they're up at bat, but they're not. I mean, a good doctor's
Jeter, this parts of
Derek Jeter. That's correct. But even Derek Jeter's human, and so your doctor may need to see you a second time or a third time, and give him this information: what works and what doesn't work. Because, sometimes I see a patient, they walk in, especially, they'll walk in and they'll say, "No." And I'll say, "Yes, what's the problem?" And they'll say to me, "Well, you should know, you're the doctor." So the bottom line is, we need information, and we need patients who interact with us, and patients who try different things, and will try different things.
Do you have any other things I could try, not lactate?
Well, we believe in supplements, and we believe in looking at your diet, and we're very, very holistic when it comes to younger people who have this problem on and off. And a lot of these conditions have a lot to do with what you're eating. So pay attention to what you're eating. Make a log of what you're eating. Write down anything that's made you better and anything that's not made you better. And I bet you your physician will have a much better time in treating you effectively.
All right, thanks a lot.
Thank you so much for the call. Once again, the number in the studio, 212-529-4620, 212-529-4620. Let us now go to Shifra, calling from Queens. Shifra?
Thank you so much for taking my call. Doctor, sometimes I have in the middle of the night, I will wake up with very strong hiccups, and they're pretty painful. I have two questions. That's question number one. Question number two is sometimes I have it's not heartburn, it's a very big bubble in my chest. I feel like there's a ton of bricks on my chest, and somebody told me if I drink warm water, it'll kindly get the bubble to go away.
How old are you, may I ask?
should I say double the age of the person before me?
So, Shifra, in your case, I think that you really should see somebody who specializes in esophageal disorders and start to run through some basic testing and to see if your condition. I assume it's something that's happening more frequently.
No, not that often.
Not that often.
The
Well,
hiccups, it happened a couple of times. It's just weird that it would wake me up.
hiccups is a very unusual thing. Hiccups can come from the most unusual causes. Some of the common causes of hiccups are irritation to the esophagus, but I've had a patient who had a little hair on their eardrum and was having hiccups for weeks and weeks and weeks till we were able to find that and remove it. And then again, hiccups can come from lung issues. It's very nonspecific, and in your case, it may very well come from some esophageal inflammation. I advise you to get that looked at and treated.
Thank you.
Thank you so much for the call. Let us now go to Judy, who's calling from Far Rockaway. Judy?
Yes, Dr. Gettenberg, you spoke about many medical problems. Does being overweight aggravate these medical problems?
Judy, I know you have your MD degree also. So I know it's not an official MD degree, but you have a voluntary MD degree. I believe your nephew bestowed that on you. But yes, that's a great question. Thank you very much. And as I'm looking out here on the lovely Lower East Side, I was always thinking about the foods that we used to eat as children. And you're right, nutrition has a very, very important role. And being overweight is a risk factor for a lot of things, including reflux disease, including for more serious diseases. And so we all have to try to exercise and watch our caloric intake and be careful, especially around the holidays.
Thank you so much. Appreciate it.
Okay, bye-bye.
Does that mean you're suggesting overweight is bad?
No, it's not bad, but it's not good.
You hit on overweight, and you mentioned Cholent earlier. Okay,
Right.
You're on thin ground here.
But if somebody
Right.
does, somebody does good Hakafis, then I'm sure they're not overweight anymore.
Well, the truth of the matter is that I exercise pretty much every day, and I watch myself, and I was in Yerushalayim for the holidays, and the food was just amazing. But at some point, you just have to go back and say, tomorrow's another day.
I think we should stop the sentence right there. At some point, you have to just go back. We all have to get back to Yerushalayim, and just being in Yerushalayim is the exercise because you walk up and down.
That's true.
You don't even notice it.
That's true.
Let us now go to Yossi calling from Brooklyn. Yossi?
Hi, Dr. Gettenberg?
Yes.
Yes, I have a couple problems. One of them is that
Yossi, could you turn your radio down?
I often wake up in the morning, in the middle of the night, and I have burps. Do you have, a solution for this?
I'm sure we do have some solution for that. That's a very common problem, Yossi. And again, these questions all relate to nutritional issues and sometimes to gastric issues. And sometimes they're not serious, and sometimes they can be a sign of more serious disease. But it's very hard to diagnose over the phone. But I will tell you, Yossi, that it's very important to be healthy and eat healthy and use common sense when you're dealing with your nutritional intake. And if you think you're doing something wrong, try to correct it yourself before you get to your physician. If not, let the physician look at it, do some tests, and see if he can come up with some answers for you.
Thank you very much for the call. Let us now go to Renee, who's calling from Midwood. Renee?
Yes. Good evening, doctor. Thank you so much for taking my call.
Good evening, Renee.
I had been operated on the gallbladder 2 years ago and developed GERD.
Mm-hmm.
I'm on a very strict diet, taking Acifex with it, and I still get the burping. Every once in a while, it just goes right back.